My Lords, this has undoubtedly been a very powerful debate with views expressed passionately, and I've got a reasonably lengthy speech here where I will address most of the points which have been raised, and if I don't address any of the questions raised, I would of course write to the Noble Lords. I'd like to begin by thanking the Noble Lady Baroness Burt for her opening remarks and in securing this debate. The issue of IPP sentence is one that continues to generate immense debate across the whole House, and indeed many of the Noble Lords in today's debate have been pivotal in ensuring some of the significant steps that have been made already. The government recognises the obstacles still faced by those serving IPP sentences, especially the 2,694 who, as at the end of September, remain in prison. It is pleasing and, as I say, to the great credit of many in this House, that the first phase of changes to the IPP licence period in the Victims in Prisons Act 2024 have now been implemented. As Noble Lords will know, the introduction of the automatic licence termination period has led to the end of the IPP sentence for 1,742 people who are on licence in the community up until commencement on the 1st of November of this year. And I well remember working with the Noble Lord Moylan on those amendments, and when Lord Wolfson was in the opposite chair, if I can put it like that. My Lords, the government does recognise, however, that this does not immediately change the circumstances for those still serving the IPP sentence in prison, and that there is still more to do to support these offenders to take the necessary steps towards being cleared as safe for release by the Independent Parole Board. My Lords, before I go further, I am aware that many Noble Lords will be familiar with the IPP sentence. However, some may not, some listening from outside may not. So I will provide a brief overview before turning to the question at hand. The IPP sentence was first introduced by the Criminal Justice Act 2003 as a means of managing high-risk individuals who had been convicted of serious specified violence or sexual offences. The Act was amended in 2008 to give the courts discretion to impose an IPP sentence provided the tariff was at least 2 years, or the offender was convicted at any time of an offence under Schedule 15A of the Act, and top-end violent and sexual offences were incorporated within that. The government are clear that it is absolutely right to abolish the IPP sentence, and we're determined to do all we can to support the remaining IPP offenders to finish their sentences. At the time of abolition, there were more than 6,000 offenders serving an IPP sentence in custody. Since then, a substantial number have been released on licence. As of September this year, 1,095 IPP prisoners are in prison, having never been released, and a further 1,599 are in prison, having been recalled to custody, as their risk could not be safely managed in the community. It is right that the release of any IPP prisoner is subject to a thorough risk assessment, and that the prisoner will be released only when the Independent Parole Board determines that the prisoner's risk is now capable of being effectively managed in the community on licence. Legislating to give every IPP prisoner a definite release date and post-release licence, or legislating to provide for resentencing by the court, would result in them being released irrespective of their remaining risk. And this, my Lords, would be the case even where the Parole Board had previously determined, and in many cases repeatedly, that they continue to be too dangerous to be released, as they have failed to meet the statutory release test. Either legislative approach would put the public at an unacceptable risk of harm, which the government is not prepared to countenance, whether or not for any IP prisoners through any or partial resentencing. My Lords, the IPP annual report published on the 15th of November covers the period up to the end of March this year, but it also includes the latest version of the HMPPS IPP action plan for this current financial year. The plan puts a greater emphasis on effective frontline delivery in our prisons. challenging HMPPS operational leaders to ensure that each IPP prisoner has the right sentence plan and access to right interventions, programs or rehabilitative services to reduce their risk of offending. This is the best way to move them closer to being deemed safe to be released by the parole board. Where these core fundamentals are in place, IPP prisoners can make progress towards release, provided they continue to engage fully with HMPPS staff working with them. The government is determined to achieve this, including ensuring that HMPPS delivers effective sentence planning and timely prisoner transfers. As things stand, around 30% of IPP prisoners are not in a prison which can deliver the requirements of their sentence plans. This plan, and particularly the effective delivery of the work stream, which focuses on the operational delivery on the ground, are the vehicle through which this situation must and will improve. Let me be very clear. We believe that these key actions will be the bedrock of significant improvements to the support and prospects of IPP prisoners. These are the right plan, the right place, the right service, and the right support for each offender. The government is determined to make the necessary progress on this issue. My noble friend, the Minister for Prisoners and Probation and Reducing Reoffending, the Noble Lord Timpson, has met many key stakeholders and is building a deeper understanding of HMPPS governance for overseeing the delivery of the plan. Just last week, he attended the External Stakeholder Challenge Group, and he knows that stakeholders will continue to hold HMPPS and the government to account. My noble friend, the Minister, remains passionate about this work and will be attending the IPP Progression Board next week to engage with the senior leaders at HMPPS who are responsible for delivery of the action plan. He has already spent significant time with staff across HMPPS, and I know he is extremely positive about the high quality of leaders and staff, both operationally and centrally, and their huge commitment to deliver effective work to better the prospects of offenders. My Lords, the refreshed plan is made up of 9 work streams covering required actions relating to operational delivery, policy and analysis. This includes important policies such as a new one on progressive prison transfers for indeterminate sentence prisoners, published on the 14th of November, which provides for the first time a formal set of requirements designed to ensure the smooth progress of prisoners to access the required interventions they need. This is important as it means that where an identified next step is agreed with the prisoner and those who manage their case, the necessary actions to transfer them to the new location can happen swiftly and with care to the inevitable disruption such moves can create for individual offenders. The refreshed plan also includes the expansion of psychology services through the prison gate for some of the more complex cases. This means additional support both for the offender, for example through bespoke one-to-one support sessions, but also for the probation officer in their management of the case. This level of continuity from the prison into the community is important in providing effective support during those often challenging early stages for offenders following release. It includes the quarterly review of progress for all detention for public protection cases in prison, those who are convicted prior to their 18th birthday. This review ensures that offenders' progress remains on track, which means they have an up-to-date plan and are engaging with it in the right prison. Where there are any concerns identified, appropriate action is taken to try and address this. It includes the continuous improvement of the internal IPP data dashboard, which gives HMPPS operational leaders important information about the progress of their specific cohorts. It includes prioritising IPP prisoners for important regular key work sessions and sentence management activity in times of high resource demand pressure across our prisons. Health plays a vital role, and sadly, we see in some cases where health or mental health issues can impede a person's ability to progress. These issues must be treated, and I am pleased that the Chief Medical Officer has agreed to the Lord Chancellor's request to consider the IPP sentence as part of his independent review of offender health. This will help us to better understand the specific health challenges faced by those serving these sentences and enable us to work with the Department for Health and Social Care to improve the support available to them. HMPPS is taking the IPP issue very seriously at every level of the service. Notwithstanding, we are making progress against a backdrop of well-known prison capacity issues and the huge strain on staff resources to implement the necessary measures to tackle it. It is important that we allow the action plan, and particularly the front-line-facing operational delivery plans, a chance to bed in before we review their progress in March next year. I can assure noble lords that if at any point it is clear more needs to be done, we will review all options to enhance the level and type of support delivered to IPP prisoners even further and take decisive action to deliver any which we believe will make a difference. Finally, it is important that this review of progress also leads to the setting up of clear measures of success in the next version of the action plan. We will use the review of the current plan early next year to identify those measures and benchmarks against which we can all gauge future progress. These will be shared as part of the next annual report and updated action plan, which will be laid in Parliament before the summer recess. My Lords, the Government's priority continues to be the protection of the public, but I hope noble lords can see that we also remain fully committed to doing all we can to support the safe progression of those serving IPP sentences. I look forward to updating the House on the progress that I'm confident the action plan will achieve in the next IPP annual report next year. Let me repeat my gratitude to noble lords who've taken part in this debate, and to address some of the points which were made by some of the points which were made by the noble lords. Firstly, Lord Moylan asked about how many will never be released. I obviously can't give him a number for that. What I can say is that we apply a red, amber, green rating of the prisoners currently on an IPP prison, and at present around a quarter have a red rating, which means they're not engaging with services at all within prison. So I think that answers his question. But I think I'll sit down there and write to the noble lords with any questions I've failed to answer.